Hello, my name is Erick Eiting. I am an emergency physician at Mount Sinai Beth Israel. I'm the medical director for the emergency department here. It is Friday night, April 10th. I'm coming in for the night shift. I feel like I'm in good spirits. It feels like the staff are in surprisingly good spirits. People are working incredibly hard, but somehow people are just so dedicated and focused and trying to make better a really trying and challenging situation. We've got plenty of patients. I've spent my entire week this week trying to increase our inpatient capacity, trying to make sure that we have enough hospital beds to take care of not just the patients who are coming to our hospital, but for all of the patients throughout New York City in the Mount Sinai Health System. And so we've increased our critical care beds. We have a plan to increase some more inpatient beds next week. And so it's been a really heavy lift, but I think that we're definitely going to be prepared. There's a really big focus on the health disparities that exist in this disease. That people who are coming from lower socioeconomic backgrounds and racial and ethnic minorities tend to be more likely to get this disease and more likely to have to go to intensive care when they get the disease, or more likely to die from it when they do contract it. And so we've been spending a lot of time this week also really trying to understand that, trying to map that out. It seems like the 911 calls across New York City in the other 4 boroughs are incredibly high, and yet for some reason they're much lower in the borough of Manhattan, which also seems to support that. So it's a really interesting story, and we're really just trying to understand it and understand what we could do to help get better control of this disease. So I'm on my way into the night shift. Looking forward to trying to make a difference.
So this is Green Pod. This is our dedicated respiratory isolation pod. This is where the action is. It's definitely gotten a little bit busier today, throughout the day. We're seeing what feels like some sicker patients today. So and then as we're walking through here, coming over to our orange area, also an acute area. A lot of action going on today.
So it's 5 a.m. I'm still on my overnight shift, and we're seeing plenty of coronavirus cases. Some people as young as in their 20s, and people as old as in their 80s. A couple of people who've been admitted to the intensive care unit. I think the best success story that we've seen this evening was somebody who had an oxygen saturation that was 48% when the ambulance got there, and the patient is now doing much better, is going to go to intensive care, but doing much better. So it's a relief when we get to see stories like that. I think the most interesting or bizarre presentation was somebody who came in with leg cramps, and it turns out they have coronavirus. So we're just seeing people with all kinds of symptoms, just such a wide variety. The other thing was we had to change our visitor policy this week. So previously it was no visitors were allowed because we were worried that we were potentially going to spread the disease to them. And we decided to change it for patients where they're very near the end of life, because we wanted to give family members the opportunity to be with their patients. And so we're making some changes and trying to accommodate that, so that people don't have to die alone. I think that that's one of the most tragic pieces of this disease, is because it's so contagious, that people do end up just dying alone, and we're really trying to do whatever we can to to make it a little bit better. So I just signed out, just finished my overnight shift. It is 8:15 in the morning. It is now Saturday, April 11th, 2020. Made it through the night. I ended my shift with a critical sick patient who came in who did not have coronavirus, which was an interesting change. I think what's also interesting right now about working in the ED is there's so many travelers. We've seen so many people just step up and come from different hospitals in different states, and everybody really wants to play their part. And you know, between the new people who are there and everybody's face being covered with their PPE, you don't even recognize anyone anymore. So it's a totally different environment. But you know, I feel like I'm walking away feeling very positive, feeling like we did some good things for patients. And it was a good night. We had a great team, and that's really what it's all about. The ER is all about teams and teamwork and making things happen. So now I'm done. I'm going home. I'm going to bed and looking forward to another day.